Now coming to the management. Uh, so I'll talk in brief about management of all the speech motor disorders we just saw. So in some cases like transient stroke, the individual may recover within 1 to 3 days or a week and may not require therapy, but majority of the cases need speech language intervention. So first coming to dysarthria therapy, we look at restorative and compensative strategies wherein with a speech intelligibility, prosody, naturalness and efficiency of verbal output is looked upon. And in compensative approaches, we try to increase the functional communication, maybe the listener skills are improved and modifying the environment wherein the patient is situated. Now coming to aphasia therapy, we try to restore the language ability, use the minimum remaining language abilities, compensate for language problems or learning a new method of communication. It can be done in individual setups or can be done in stroke clubs for group sessions also. Nowadays, we also have a lot of mobile apps available. So some of the approaches are focused on training the individual for effective communication using the following. So what happens when there's a very mild case of aphasia or apraxia, it is we have verbal output, so it can be drilled, it can be worked upon very well. But when we have moderate to severe cases of aphasia, you require a slightly different approaches to make sure there is enough verbal output of the patient itself. So we use music or melodic intonation patterns for improving the expressive language. And when we are aware that the patient is not able to or lacks the verbal expression, so other things like the gestures for non-verbal communication can be used upon, drawing can be used, or even the individual can be taught to use a sign language. So we have something called as communication boards or AAC, which can be used for dysarthria, aphasia, apraxia, or any normal communication disorder also. In fact, when the patient is on ventilator or when the patient is consciously aware in ICU and when he wants to talk, but but he's intubated, he cannot talk, you can make use of these simple communication boards wherein he can communicate at least his daily needs. If he wants to go in the bed, sit down, lay down, increase the temperature, feeling cold, call the relative, he can use any of the pictures, and these pictures can be customized as per the patient's requirement. If the patient is educated enough and the patient has good cognitive skills, maybe we can use something like this, wherein you give a printed keyboard to the patient wherein yes, no, I start with, or he can trace the words what he wants to say. Maybe if he wants to say food, he'll go to FOD, where we can try to guess he's going to say food, something like this. So right, these are very rudimentary pictures what I have used, but right now, given the latest technology available, we also have a lot of mobile apps, we also have dedicated devices which can be used for communication with these patients, wherein at least, and so therein there is this myth that if you start using gestures or communicate for communication, or if you tell people to use pictures, they will not develop speech language verbal outputs, which is absolutely wrong. So when you start using these pictures or simple gestures for communication, the patient's frustration and inability to communicate reduces, whereby facilitating the verbal output of the patient. So using these picture communication boards is very, very, very essential and is very recommended in the research itself. Now, as a doctor or as a therapist, how can you communicate with the patient them? First is reduce the background distraction or the noise, give the individual time to talk, make eye contact when they're talking, don't look here and there when you're having a conversation, ask simple questions, yes and no questions. If there is no verbal output, at least they can do a head nod or at least blink their eyes to communicate. If the patient is verbal, try to ask close-ended questions. Tell them when you have trouble understanding the questions. Don't complete their sentences or correct them. Encourage them to use gestures or at least write before there is communication breakdown. Usually what we do is, oh, abhi aapko nahi samajh raha hai, abhi aap likhiye. So we wait for the communication breakdown to happen, and then we tell the patient to, oh, please now write it, I can't understand it. So when you see there is a cue, there is a breakdown going to happen, please encourage the patient to use gestures or at least write. In cases of aphasia, if the writing is distorted, maybe you can still use gestures. Sometimes the patient is not even able to use gestures, so in that case what we could do is use a communication board, or at least try to use simple yes and no things, or a smile, or a blink of the eye. These things can also be used for communication. But in cases of dysarthria, they can definitely write if there is no hemiparesis present, or if the dominant hand is available, or if we have the non-dominant hand available, you can always ask the patient to type it out also.